Video has to do with Mazi Nnamdi Kanu's health because it's been in the news for a long time now. The health situation of Mazi Nnamdi Kanu and what the Nigerian government has decided to do about it is very, very important. This news just broke a few minutes ago, and here in Noble Media, we are bringing it for you so that you will know exactly how Nnamdi Kanu's health is doing. Nigerian Medical Association, this is the headline of this news. Nigerian Medical Association conducts court order checks on Mazi Nnamdi Kanu, submits their report. The court ordered them to check on his health and submit their report. The Nigerian Medical Association has conducted the court order health examinations on the detained leader of the indigenous people of Biafra, Mazi Nnamdi Kanu. The Punch report, if you are over there in Nigeria, or even if you are following news that go on in West Africa in Nigeria, you should know Punch newspaper. The Secretary General of the Nigerian Medical Association, Dr. Ben Ebu, confirmed the development in an interview with our correspondents on Sunday. The Federal High Court in Abuja had on September 26 ordered the Nigerian Medical Association to, within 8 days, conduct a panel of medical experts to assess the health condition of Mazi Nnamdi Kanu. If you followed our news, our channel, on that very day 26, we were here giving you the updates. Even when Nnamdi Kanu was in court, we gave you all the updates, right? It was on that day that we had expected that they will release Mazi Nnamdi Kanu, but it didn't happen, right? Instead, they said the Nigerian Medical Association should set up a committee and assess Nnamdi Kanu's health. In his ruling, Justice James Omotosho ordered the Nigerian Medical Association president, to submit the committee's report within 8 days for consideration on whether Mazi Nnamdi Kanu should be transferred to the National Hospital for treatment because of the several illnesses Nnamdi Kanu is passing through due to what DSS subjected him to while he was in Kenya. That's when they kidnapped him in Kenya and when they brought him back to Nigeria. Because of all those issues, his health has gone down. He has gone down, and in fact, sometimes he bleeds in his nose. There's fainting episode. He cannot sleep and all the rest. On Sunday, the Nigerian Medical Association Secretary General Ebu said the evaluation had been done as ordered by the court, adding that the report had been submitted to the Attorney General of the Federation. Let's now look at what this man said. Ebu said, the court gave an order that we should do it, I think, within 8 days. And immediately the Department of State Services wrote to us, we summoned a committee of 7 doctors with 1 coordinator, making it 8. 7 doctors with 1 coordinator, making it 8. We had the 7 doctors from the 7 geopolitical zones of Nigeria with different fields of specialty in ophthalmology, neurology, urology, gastroenterology, and other various areas of specialty. All of them from the 7 is Nnamdi Kanu said is now a national emergency, a national issue, a burning matter in Nigeria that they had to bring doctors representing each geopolitical zone to examine him. They went there, examined him, that's examine Mazi Nnamdi Kanu, and the committee wrote their report to us, and it was sent to the Attorney General of the Federation. The judge's ruling followed an application by Mazi Nnamdi Kanu to be moved from the custody of the Department of State Services to the National Hospital over what he described as his failing health. Nnamdi Kanu and his lawyers has asked Nigerian government move him to the National Hospital in Abuja so that he can get adequate care before it is too late. Nnamdi Kanu is not feeling fine. His sickness, his heart, his pancreas, his liver, his kidney, his potassium level is so low. He's having serious health crisis because of what he's suffering. He suffered when he was captured in Kenya and the kind of treatment they keep giving him here in Nigeria. Yet, the Nigerian government, DSS, has refused to take Nnamdi Kanu to a proper hospital. That's why I encourage you to come under the comment of this video and type Tinubu Nnamdi Kanu must not die in your hand. Allow him to go to hospital now. Tinubu, Nnamdi Kanu must not die in your hand. Allow Mazi Nnamdi Kanu to go to hospital now. Type it in the comment section because it's very, very needed and important. The just ruling followed an application by Nnamdi Kanu to move to the custody of the department from the custody of the Department of State Services to the National Hospital over what he described as his failing health. The judge directed that the committee, among other tasks, should assess the DSS hospital to confirm whether it has the capacity to meet Mazi Nnamdi Kanu's health needs. This judge, the Motosho, asked this committee by Nigerian Medical Association to look at the health facilities of DSS, because they were saying that they cannot release Nnamdi Kanu to go to another hospital, that they have adequate hospital equipment, adequate hospital personnel to take care of Mazi Nnamdi Kanu, despite that he is dying slowly. The judge directed, Justice James Omotosho further ruled that the Nigerian Medical Association committee would be at liberty to make use of any hospital in the country for its investigations. The General Secretary emphasized that any further inquiries be directed to the Ministry of Justice. We have submitted the report to the Attorney General's office as instructed. This is Nigerian Medical Association talking on Nnamdi Kanu's sickness. Anyone seeking further details should contact the Ministry of Justice, he added. Meanwhile, Kanu, through his legal team, has petitioned the World Medical Association over what he described as serious health challenges and inadequate medical care while in custody of the Department of State Services. In a letter dated October 3, 2025, and signed by Mazi Nnamdi Kanu's International Counsel, Bruce Fein, on his behalf, and addressed to the World Medical Association President, Dr. Jacqueline Kitulu, Kanu complained that his health condition had deteriorated due to insufficient medical attention while in detention. It's very important we look at it. Don't forget, come under the comment of this video and type Tinubu, Nnamdi Kanu should not die in your hand. Tinubu, don't allow Mazi Nnamdi Kanu to die in your hand. Allow him to get proper medical care. Omotosho, Nnamdi Kanu must not die. Allow him to get proper medical care before it is too late for everybody. He stated that he has been detained in a Nigerian facility in solitary confinement, that he is not allowed to talk to anybody, for more than 4 years without a trial. He was arrested in Nairobi, Kenya in June 2021. The letter, which was copied to the Register of the Federal High Court, Abuja, the Department of State Services, the Medical and Dental Council of Nigeria, and the Nigerian Medical Association, said the situation had reached a life-threatening threshold. It appealed to the World Medical Association to engage with the Nigerian Medical Association to ensure that Mazi Nnamdi Kanu receives the highest professional standard of medical care and that his medical providers are allowed to work without intimidation or interference. Look at what Nnamdi Kanu's team are asking the World Medical Association, that the highest professional standard of medical care, that Nnamdi Kanu, to ensure that Nnamdi Kanu receives the highest professional standard of medical care, and that his medical providers are to be allowed to work without intimidation or interference, because that is what they are alleging, that most of the time people taking care of Nnamdi Kanu's health, doctors, are intimidated, harassed by Nigerian DSS. Kanu also requested that the World Medical Association, directly or through the Nigerian Medical Association, to review what he described as irregularities in his medical records while in DSS custody. The letter further sought protection for independent medical practitioners from any possible retaliation for providing medical care to Mazi Nnamdi Kanu. Nigerian government, DSS, are retaliating against the doctors that are taking care of Nnamdi Kanu, intimidating them, fighting against them. He demanded the release of the Nigerian Medical Association Medical Terms Report of September 22, 2025, which the Federal High Court had directed to be filed within 4 days. He warned that any delay could create the real danger that a replacement panel may be assembled, thereby undermining the medical truth. According to the letter, Nnamdi Kanu's health challenges reportedly began after his detention in Nairobi in June 2024. This is the history, and it's important. Every lover of Nnamdi Kanu, every lover of freedom, whether you are an African, whether you are a Biafran, whether you are in Nigeria, whether you are living in outside Nigeria, it's very important we know this. According to the letter, Nnamdi Kanu's health challenges began after his detention in Kenya, in Nairobi. On arriving at Jomo Kenyatta International Airport, this is important. That's why you need to click on like this video and share this video. Let more people hear the genesis of Nnamdi Kanu's health, so that if anything happens to him, people will know where it started from and who to hold responsible. On arriving at Jomo Kenyatta International Airport in Nairobi, that is Kenya, Nnamdi Kanu was taken into custody by a masked, they put on mask operative, and held for 8 days in a confined room. He said he was allegedly denied food. He was not given food. He was not given water, and he was not given medication for the first 5 days, leading to breathing difficulties and weakness. On the 5th day, when his body began to fail, a doctor was summoned. His blood pressure was dangerously high. Nnamdi Kanu was given a 40 milligram dose of amlodipine along with a red-colored liquid, the letter stated. Kanu said his treatment in Kenya left him physically weakened by the time of his transfer to Nigeria. In the DSS facility in Abuja, blood analysis allegedly revealed a critical potassium deficiency, prompting a series of medical prescriptions that reportedly failed to stabilize his condition. Whenever potassium supplements were withdrawn, Nnamdi Kanu's levels dropped again to the same life-threatening ranges. He claimed, according to that, adding that a South African laboratory confirmed the deficiency. He further alleged inconsistencies in his medical test result under one of the physicians assigned to him in custody. From the moment that is Dr. Nasiru Mohammed, that the DSS brought to be taking care of Nnamdi Kanu, while preventing Nnamdi Kanu's personal doctors to reach him. From the moment he assumed control, the doctor began recording normal potassium levels, when in reality they were very low. Under what he described as inadequate care, Nnamdi Kanu reportedly continued to experience nose bleeding. Can you imagine? Nose bleeding, fainting spells, chest pain, headache, and swelling of the feet. This is what Nnamdi Kanu is going through because of his people. Over 50 blood samples had been taken during Nnamdi Kanu's time in DSS custody, but these have yielded no improvement in his health under the management of the assigned doctors, the letter stated. He praised Emeritus Professor Martin Ahaji, a respected surgeon, for stabilizing his condition when he was eventually allowed to intervene. It is no exaggeration to say that without Emeritus Professor Martin Ahaji's intervention, my health would have deteriorated beyond recovery, Kanu was quoted as saying. The letter added that Professor Ahaji confirmed a range of health concerns affecting Kanu's liver, kidneys, bladder, prostate, and white matter, as well as sleep apnea and severe tinnitus. Among the gravest threats to Nnamdi Kanu's survival today is tinnitus. It robs him of sleep, exacerbates hypertension, magnifies chest pain, and places him in immediate danger of stroke, collapse, and sudden death. Immediate danger of stroke. Somebody type God forbid in the comment section. Somebody type God forbid, stroke, collapse, and sudden death. He said sleep deprivation combined with existing hypertension, organ strain, and potassium instability places Nnamdi Kanu in immediate danger of stroke, collapse, and sudden death. According to the letter, the Nigerian Medical Association's medical assessment of September 22, 2025 confirmed Ahaji's finding and identified an additional condition requiring nasal surgery. Even Nnamdi Kanu needs surgery. The Federal High Court has ordered that the report of his assessment be submitted within 4 days. He wrote, any delay creates the real danger that a replacement panel may be assembled, thereby undermining the medical truth. The letter urged that the conduct of all medical personnel involved in Mazi Nnamdi Kanu's treatment be reviewed to ensure compliance with professional ethics. Neglect of tinnitus and sleep deprivation shows a disregard for the life-threatening impact of untreated condition, Bruce Fein said. He appealed to the World Medical Association to ensure the release of the Nigerian Medical Association report, protect Professor Haji's role as Nnamdi Kanu's physician, and review the treatment he has received, recognize tinnitus and sleep deprivation as urgent medical issues. Without immediate decisive action by the World Medical Association and Nigerian Medical Association, the medical neglect of Mazi Nnamdi Kanu may prove fatal, he warned. As of the time of filing this report, the DSS could not be reached for comments. As of the time we are making this video, we have not been able to reach DSS. Punch has not been able to reach DSS, as the agency currently has no official spokesperson. DSS doesn't have any official spokesperson as of this moment, but it's a developing story and we'll be monitoring it here in Noble Media. So go ahead, like this video, share this video, click on join to become a full member of our channel, and most importantly, like this video. There's another important video on the screen. Click on it and watch now.